Now, I will introduce the position of the suction tip where it grasps or holds in a mode that is perpendicular to the tooth axis rather than parallel to it. The patient's head should be rotated towards the right side. The operator's body should be fully rotated, aiming towards the patient's head, positioning themselves as close as possible to the 6 o'clock mark, directly facing the patient's head. The key point of the doctor's position is that your right arm should be positioned as close to 6 o'clock as possible, to the extent that it can comfortably rest on the patient's right shoulder. To achieve this, the tip is to first push the doctor's table back to create sufficient space, then meticulously coil the handpiece line around your right arm, resembling a screw, ensuring it does not come into contact with the patient's body. One helpful tip before assuming the position is to push the doctor's table as far back as possible to ensure it doesn't obstruct you, and then to position yourself as close to the 6 o'clock direction as possible. It is more comfortable to keep your legs together, and your neck and lower back should not deviate significantly from a stable range. For the rest, position the 4th and 5th digits of your left hand on the right masseter muscle, and the 4th digit of your right hand should rest on the anterior mandibular teeth. Then, place the burr on the incisor edge of tooth number 22. The suction tip should be gripped with your left hand, curved in an outward direction, away from the operator's body, and then precisely positioned at the right oral angle, facing this specific direction. Let's check tooth 22's buccal prep. The doctor's position is specifically at the 9:30 mark, directly facing the patient's head. Place the 4th finger of the right hand on the premolars in the number 10 quadrant for a rest, and then set the handpiece. The suction in the left hand. It can be positioned on either the right or left side of the oral cavity, but it is preferable for the secondary curve of the suction tip to bend toward the operator's body. This is to ensure that the volume of the suction tube does not obstruct your movements when performing a rest on the premolar area with the 4th finger of your right hand. A very useful technique here is to position the obtrugate wing vertically with the 1st finger of your left hand, effectively preventing water spray from the handpiece from splashing. Another method for left-hand suction involves placing a rest on the right masseter muscle and approaching from the right oral angle. Depending on the situation, you can use the more convenient method, whether approaching from the left oral angle or the right oral angle. Let's watch more of the video. This scene shows prep with suction from the right oral angle. Next, we will look at a scene where a prep is being done while simultaneously suctioning from the left oral angle. We will look at prepping the mesial from the buccal direction of tooth 22 and prepping the distal from the buccal direction of tooth 22. The suction tip is positioned perpendicularly to the tooth's axis. Since it's a vertical, perpendicular alignment, the operator's position is at 9:30. The patient's head is turned to the right. When prepping the bucco-mesial, the operator's neck and back are within a normal range. When preparing the bucco-distal area, in order to get a clear view of that region, the operator's back will naturally bend forward and to the left, while the neck will slightly bend forward and to the right. It is generally advisable to avoid positions where the body is significantly bent, like a D. In this particular instance, there's no need to unduly strain your posture by forcing yourself to prep the buccal distal area in a perpendicular R mode. You can achieve a healthier posture by utilizing either the perpendicular L mode or the parallel mode. Therefore, what I want to convey here is that it's highly advantageous if you have a selection of various postures and multiple approaches when you're preparing the target area of each tooth surface. This way, you can effectively distribute the physical burden and strain across different parts of your body, which is much better for your well-being. From my personal experience, the most detrimental posture is when you statically hold a position for an extended period, causing the burden to concentrate on a particular area of your neck or lower back. Now, let's take a look at the video demonstration. Prepping the buccal mesial area. Prepping the buccal distal area. Prep tooth number 22's mesial from the palatal side. Perpendicular to the tooth axis, the suction is in grasping mode. Positioned at around 9 o'clock, I'm looking toward the patient's head. The patient's neck is turned as far to the left as possible. In this specific situation, and unlike typical cases, it is advantageous for the operator's body posture if there is an appropriate amount of space maintained between their body and the patient's head. With a moderate distance, the waist is in a slight forward flexion and the neck is also in a slight forward flexion. In that position, a slight rotation of the neck to the left will allow you to get a direct view of the palatal mesial area. If the operator's body is positioned too closely to the patient's head, as is often the case, it becomes challenging to lean forward at the waist. This leads to excessive forward flexion and left rotation of the neck, consequently concentrating the strain on it. Another point to mention is that for improved visibility, it's beneficial to hold the handpiece long with your right hand rather than short and to place the rest on the right masseter. If you hold the handpiece short with your right hand, the rest would be positioned on the premolars in the number 10 area, thereby obstructing the clear view of the target region. The palatal distal area is not well suited for the perpendicular R mode. Instead, the perpendicular L or parallel mode is more appropriate, so we'll omit covering it at this time. Now, in this slide, the top photo shows the posture for prepping the palatal mesial area in parallel mode. The bottom photo shows the posture for doing a prep on the palatal mesial area in perpendicular mode. In parallel mode, you should place your body very close to the patient's head, similar to the red line, and also turn the patient's neck to your right, towards the operator. In perpendicular mode, the operator's body is positioned at an appropriate distance from the patient's head, much like this yellow line indicates. You also turn the patient's neck to the left, away from the operator. This is the same length as the red line from above, just moved down. Comparing the lengths of this yellow line and the red line allows you to compare the differences in the distance between the patient's head and the operator's body in the upper and lower images. These differences in length and distance come from the operator's body being positioned differently. In the parallel mode above, the operator is at the 11 o'clock position. In the perpendicular mode below, they are at the 9 o'clock position. The distance between the operator's body and the patient's head is adjusted accordingly to secure a proper field of view. Now, let's change the posture mode once more and explore the category of settings for the perpendicular R position, where we'll focus on hooking the suction onto the oral angle instead of merely grasping it. Starting from the incisor, in the perpendicular mode, the operator's body is positioned at 9 o'clock. The patient's neck and back are positioned within a comfortable and stable range. The suction tip is curved inward and then securely hooked onto the patient's right oral angle, creating a secondary curve. With the right hand's fourth and fifth fingers, place the rest on the mentum and approach the incisor with the handpiece. Because the suction isn't being held, the left hand is free to either hold the mirror or prop up the obturgate wing while simultaneously providing auxiliary support for the handpiece head. Now, if you examine this section, you'll observe the action of actively adjusting the chair switch pedal to align with the operator's body positioning. Let's consider it from this perspective. For maintaining a healthy posture, a crucial technique is to effectively adjust the chair switch pedal. This should align with the operator's torso and the position of the leg that extends from the operator's body. Next, let's see the prep posture for the buccal surface, the mesial from the buccal, and the distal interproximal from the buccal. The operator is at 9 o'clock. For achieving optimal visibility of the 20s region, the patient's neck is often rotated quite significantly to the right. For the buccal and the mesial interproximal surfaces, when approached from the buccal, visibility is quite good, even if the operator's back and neck are within the normal range. However, in order to secure a good field of vision for the buccal-distal area, the operator needs to bend their waist to the left, and the operator's back goes into forward flexion, and the neck goes into forward flexion, and there will also be a rightward rotation. To elaborate, the waist twists to the left while the neck twists to the right in the opposite direction. In this situation, it is actually more beneficial for the operator to move their core, which is the foundational root of proper posture, in the direction that unwinds the twist, which, in this instance, is this particular direction. This can be generalized into a formula. To summarize, if you can relieve the twisting in the operator's neck and back by resetting the operator's core position, it is always better to reset the operator's core position. Now, let's observe this. At this specific point, we will shift the operator's position from its initial 9:30 o'clock setting and incrementally move it further in a clockwise direction. Let's review this once more. This is precisely why you should move it in a clockwise direction. The rest for the right hand is placed on the canine area of the tens. This is because the handpiece is held with a short grip rather than a long one, providing the necessary stability for the procedure. My free left hand, using fingers 1, 2, and 3, holds the obtrugate wing vertically to block water spray from the handpiece, while fingers 4 and 5 rest on the left masseter. In actual fact, for the preparation of this bucco-distal area, the parallel or perpendicular L mode is indeed more appropriate and better suited than the perpendicular R mode in this slide category. This signifies that your waist and neck will experience considerably less strain and discomfort. Depending on the target subsurface region, there is always an alignment mode that adequately allows for clear visibility and a comfortable posture for the operator. Knowing how to select the best option is indeed a helpful tip. This time, let's look at the posture for the palatal, mesial, and distal adjacent surfaces. The doctor's position is at 9 o'clock, aligned perpendicular to the tooth axis. Tooth axis direction this way, operator body orientation this way, aligned perpendicularly. To secure the line of sight, the patient's head is rotated as far left as possible, according to the doctor's position at around 9 o'clock, rotate left. The operator's back is within the normal range, and the neck is slightly rotated to the left. Hold the handpiece with a long grip, resting your right 4th and 5th fingers on the right masseter. With your free left hand, it's good to place a rest with your 3rd finger on the labial surface of the anterior teeth and use your 2nd finger to provide auxiliary support to the handpiece. Holding the handpiece with a long grip is to prevent the bulk of your hand from obstructing the palatal view. Also, providing auxiliary support to the handpiece head with your left hand helps fine-tune the slightly rougher movements that can happen when gripping the handpiece with an extended hold. In this specific case, as the left hand rests on the rigid tissue of the tooth, providing supplementary support, the right hand's rest can be positioned further from the oral cavity on the less stable, softer masseter tissue. If the left hand doesn't provide auxiliary support from a hard tissue rest, it's more balanced to hold the handpiece shorter, placing the right hand's rest on the hard tissue of the mandibular anterior teeth instead of the masseter, even if it slightly sacrifices visibility. Let's watch a brief video.